Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is called Chronic Obstructive Pulmonary Disease. Chronic obstructive pulmonary disease, or COPD, is a group of progressive diseases that restrict airflow and cause trouble breathing. COPD can be prevented and it is treatable. One of the diseases is emphysema. The alveoli, or air sacs, are destroyed and lose elasticity. They are then unable to properly exchange oxygen and carbon dioxide, and some air stays trapped during exhalation. With chronic bronchitis, there is inflammation of the lining of the bronchial tubes, which leads to increased mucus production, which then further blocks the narrowed tubes. Chronic lower respiratory diseases, including COPD, are the third leading cause of death in the United States. More than 15 million Americans have been diagnosed with COPD. There may be many more who have the disease but are unaware. COPD leads to more than 700,000 hospitalizations in the United States each year. Tobacco smoke causes 85 to 90% of all COPD cases. It is a key risk factor in the development and progression of COPD. This also includes cigar smoke, secondhand smoke, pipe smoke, and marijuana. If you are around smoke and have asthma, you have an even higher risk of developing COPD. Indoor and outdoor, home and occupational air pollutant exposures can include heating fuels, dusts, gases, and chemical fumes. A genetic predisposition, including a rare genetic condition called alpha-1 antitrypsin, or AAT deficiency, can also increase your risk. AAT is secreted to help protect the lungs, so with a deficiency, there isn't as much of the enzyme to provide protection. COPD develops slowly, and most people are over 40 when their symptoms begin. In some cases, asthma can cause COPD, as it is a chronic disease that inflames and narrows the airways. Some people may have no symptoms or mild symptoms at first, and the symptoms may not be noticeable until significant lung damage has occurred. The symptoms worsen over time. Some symptoms include chronic cough, also known as smoker's cough, wheezing, chronic mucus production, where you need to clear your throat often, especially in the morning, shortness of breath, especially with physical activity, inability to take a deep breath, chest tightness, cyanosis or blueness of the lips or fingernail beds, frequent respiratory infections, fatigue, swelling, especially in the ankles, feet, and legs, and weight loss in later stages, as you may be too fatigued or short of breath to eat. Doctors will use multiple methods when diagnosing COPD. They will perform a physical examination to listen to your breathing. They will ask about risk factors and signs and symptoms, as well as your personal and family medical history. They can perform a pulmonary function test to measure the amount of air inhaled and exhaled, and to test if the lungs are delivering enough oxygen to the blood. Spirometry is the most common lung function test. With spirometry, you will blow into a large tube connected to a machine. It measures how much air the lungs can hold and how fast air can be blown out of the lungs. It can detect COPD before you have symptoms and can also track the disease progression. They may perform a chest x-ray which can show emphysema and can rule out other lung problems and heart failure. A CT scan can be done to show emphysema and screen for lung cancer. Blood tests may also be done. Most commonly, they can do an arterial blood gas to measure how well the lungs bring oxygen in and remove carbon dioxide from the blood. Other blood tests may be used to determine a reason for the symptoms or to rule out other conditions. It may also be used to detect if you have the genetic AAT deficiency. There is no cure for COPD, and you cannot reverse damage that has already been done. You should avoid tobacco smoke and pollutants to prevent further damage. The goal of treatment is to improve the overall quality of life. It is to alleviate or control symptoms and decrease the frequency and severity of exacerbations. Early COPD detection is best for successful treatment. They may recommend pulmonary rehabilitation, which provides breathing strategies, energy conservation techniques, exercise training, and nutritional counseling. You may be prescribed a medication to deal with the symptoms. Bronchodilators, which are usually in the form of an inhaler, may be short or long-acting depending on your needs. They help relax the airway muscles and help relieve coughing and shortness of breath. Inhaled steroids reduce airway inflammation and help prevent exacerbations. Combination bronchodilators and steroids may be used to reduce inflammation and decrease mucus production. Oral steroids may be used for moderate or severe acute exacerbation and can prevent further worsening of the condition. Phosphodiesterase 4 inhibitors are for severe COPD and chronic bronchitis symptoms. They decrease the airway inflammation and relax the airways. Theophylline helps improve breathing and prevent exacerbations. Antibiotics are used for respiratory infections, which can increase COPD symptoms, to treat acute exacerbations. Oxygen treatment may be used if you are not getting enough oxygen in your blood. Some may use it during activities, some use it during sleep, and some use it all the time. It is the only treatment proven to extend life for those with COPD. Surgery may be recommended for some people with severe emphysema and the medications do not help. One surgical procedure is called lung volume reduction surgery. This removes small areas of damaged upper lung tissue and provides more space for healthy tissue to expand. It can improve life quality and prolong survival. With a bulectomy, large air spaces, or bullae, form when air sacs are destroyed. They can be large and cause problems breathing. They are removed to help improve airflow. A lung transplant may be done to improve your breathing ability, although you can have organ rejection and have to take lifelong immune-suppressing medications. It is important to prevent further lung infections, and you should talk with your doctor about certain vaccines, such as flu, pneumococcal, and Tdap, for the pertussis or whooping cough portion. You should wash your hands often, tell others to visit only when healthy, and be sure to treat any respiratory infections. Palliative care can be important for those with COPD. It treats the symptoms, pain, and stress. This is not end-of-life care. It is care for chronic illness sufferers, and it helps you and your caregivers with a higher life quality. COPD can cause negative consequences. You may have activity limitations, such as walking, climbing stairs, going out for social interactions, and you may be unable to work. You may need supplemental oxygen. It can lead to increased confusion and memory loss. You may have more ER visits or hospitalizations due to acute exacerbations where your symptoms worsen for a period of time. You're also more likely to catch colds, flu, and pneumonia, and it makes it even more difficult to breathe with respiratory infections. You may develop other conditions such as heart disease, heart attack, lung cancer, or pulmonary hypertension, which is high blood pressure in the arteries that bring blood to the lungs. It may lead to emotional changes, such as depression, anxiety, anger, or frustration. You may need medication, and you could join a support group or attend counseling. Be sure to share your feelings with family, friends, and your doctor. Seek immediate care if you have bluish or gray fingernails or lips, as this is an indication of low blood oxygen levels. Also, if you have trouble catching your breath or you're unable to talk, you feel confused or faint, your heart is racing, and your home treatment is not working. You can still live a healthy and active life with COPD. Try different breathing techniques and find positions and techniques that work for you to improve your breathing when you are short of breath. Keep your airways clear and stay hydrated to thin the mucus secretions. Exercise is important as it can improve sleep, decrease stress, improve endurance and strength, including your respiratory muscles. If you are normally on oxygen, be sure to use it when exercising. Keeping a healthy diet can help you maintain your strength. If you are overweight, losing weight can help your breathing. Eat frequent small meals, as a full stomach can make it harder for your lungs to fully expand. Some foods produce more carbon dioxide. Avoid foods that cause gas and bloating, as this can make it more difficult to breathe. Talk to a dietitian to make sure you are choosing foods that are best for you. Avoid pollutants to prevent further damage. Keep irritants out of your home. If your home needs painting or insect spray needs to be used, have someone else do it while you are away. Monitor the outdoor air quality and stay inside on bad air days. Go to your regular doctor visits so they can monitor your lung function, assess medication effectiveness, and manage other chronic conditions. Take your medications as prescribed to manage your COPD symptoms. Don't be afraid to ask for help from friends and family to assist with your life quality. They can help with housework and shopping. Keep items that are used often in easy to reach places. There are ways to prevent COPD. Your lung tissue is connected to the outside environment, so anything you breathe in can affect your lungs. Avoid tobacco smoke, including secondhand smoke. Quit now if you already smoke. Talk to your doctor if you are having trouble quitting, as they may recommend different medications or support groups. Avoid air pollutants. Be sure to talk to your doctor about your exposures and find out if you need to use any respiratory protective equipment. And prevent any respiratory infections that over time can make you more susceptible to COPD. With any chronic illness, you should always be prepared. Be sure to carry emergency contact information, including for a family member, a friend, a doctor, and the hospital. Always keep a list of your medications, including the strength and when you take them. Create a living will or advance directive, which outlines your end-of-life care wishes. Select a power of attorney for both medical and legal purposes. They may be the same person or different people. They can make decisions on your behalf if you are unable to. And create a will to dedicate who your belongings go to. This concludes the COPD presentation. If you have questions, please call your doctor or visit any of these websites as they provide valuable information. Thank you.